Hello again, and welcome back to the Feel Better podcast. I'm Doug Kirkwood, again with another special guest to help us make us feel better. Dr. Geoff Johnston from Tread Health. Welcome to the Feel Better podcast, sir.
Thank you very much. Thanks for having me.
Pleasure to be here. So tell us about your day. What kind of an issue did you have today, being a chiropractor?
Yeah, you name it. I mean, I see a lot of low back. I see neck. In terms of what I saw today, people dealing with tension. I think it's back to school, back to regular schedules. The summer is gone. They're committing to their work, and so it's stress, it's neck tension, helping people through those kinds of issues. So yeah,
you must be finding the economy right now is very uncertain for a lot of us as well. Extra stress. Are you seeing more people come through your door as a result of that?
No doubt, and I think it's rarely one thing in isolation, but just the accumulation of factors over time. If it's the Blue Jays being down 0-2, if it's economy, if it's whatever, usually these things, they stack on each other and the body keeps the score. And so if there's mental stress, emotional stress triggers, your body is going to feel it and it's going to manifest as tension, aches, pains. And that's where I come in and help.
So somebody who has never, ever had a chiropractic treatment, they don't know anything about it.
Yeah.
Is there anything that people are usually surprised to find out when they come and see you that they've never known about chiropractic before?
It's a good question, because we all have an image. Most of us have an image of what chiropractic is from social media, from popular media. The biggest surprise, what I hear from patients if it's their first visit, is it's not just the adjustment. It's not just spinal. It's full body. It's treating the body as a system. And people are surprised at the extent of the muscle work that I do. Like the bulk of my session is typically muscle work, adjustments when they're needed, of course, other tools, electroacupuncture, other modalities, and a lot of rehab work that people often think is in the realm of a physio. But from my perspective, if you're not addressing rehab work, if you're not giving people strategies to move better, to get stronger, you're just missing such a big piece of it. So I think people think adjustment, people think spine, and it's broader and just, from my perspective, leveraging different tools to get the achieved result. Yeah.
You touched upon physio. So how would a person decide what kind of a practitioner to use? Do I go to a chiropractor? Do I go to physio? Can you talk a little bit about the difference between the two?
It's such a good question. I get this from family members. Got it over Thanksgiving weekend. Where I stand is go see someone who's good. That's my party line. Go see a good practitioner. The follow-up question is, how do you know someone's good? From my perspective, it's giving them a few things to look for. So there should be a detailed history. The practitioner should really ask investigative questions. You really want to pull out the relevant info in terms of what's contributing to their issue. There should be a detailed physical. It should involve muscle testing, joint testing, functional movement testing. I want to see you squat. I want to see you walk, breaking down how people move. And from there, the practitioner should be able to communicate an effective diagnosis. The patient should be able to go home and tell their spouse, this is what is going on. Because too often, the language is nebulous. People get lost in the weeds. People don't know what's going on with their own bodies. And so that effective communication, relaying what's at play, it's so important for the person to learn. So those two factors are huge. And treatment should evolve with the person. If treatment is staying consistent, if it's static, if it's the same thing day in, day out, that's a flag. It should evolve as you evolve. It should progress with you. So those are a couple things to look for. And I like different tools, different treatment strategies to get someone there. If it's always only one thing, I mean, certain instances you just need muscle release, but there should be a variety of tools, in my opinion.
So give me an example of something like that, because I had chiropractic treatment many, many years ago, and sometimes there was a machine called the thumper, and the thumper would be pounding away on my back or my shoulder or whatever that might be. And then the actual chiropractor may be using an elbow or a fist or a knee.
Yeah.
Do you say, yeah, you still use that?
Getting in there. Yeah. It depends on the person. It depends on the presentation, but it would really depend. If it's the LOL, the little old lady with bone density issues, you're going to go the softer touch. But if it's the 35-year-old gym rat who's bulky, he's got a lot of muscle, you need to get in there with some leverage. Thumper, it's a great tool. Vibrational therapy, the Theraguns.
I have a Theragun at home I use quite often, actually.
They're incredible, especially at kind of tenderizing the tissue.
Mm-hmm.
Maybe there are better words to use there. And things like electroacupuncture, just to modulate muscle tone and their nervous system. So there are ways to approach different presentations.
So the nervous system, is that related to stress as well? Because do you see people that coming in and they're like, Dr. Geoff, I've got a problem, but I'm not really sure what it is. It could be a neck issue. It could be a headache. It could be sciatic issues. It could be a back issue. And then upon a little bit of a deeper dive, you find out your problem is actually stress here. You haven't damaged any part of your body. Do you have that happen?
100%. Yeah. And it's typically part of it. In the way I use a cup analogy of, there are countless triggers throughout the day, throughout our week. Say it's work postures. You're stuck working, you're stuck sitting. Muscle tension builds. That builds up. It lifts the level of the water in a cup. Say you're doing a new workout regimen. That's increasing the stress on the body. Just mental stress, emotional stress, it raises the level of that water in the cup. And often it's one of those things that pushes us into overflow. And so that nervous system, your ability to regulate is so important. And often with pain, we talk about stress management strategies, ways to kind of bring that nervous system down to be able to regulate. And we're in that kind of more maintenance level stage. Yeah.
Let's talk about that, because a lot of people do sit at work, myself included, and I get achy, and I'm getting older and I'm getting achy. And what kind of a tip or is there anything that I can do, or anybody who's watching, what can you do to kind of relieve that stress? You're feeling a little bit of a pain. How important is it to keep moving?
That's the key. Yeah. Motion is lotion. A variety of position. It's always I cringe a little when I hear perfect posture. It's just not a reality. And I think it's too much to ask of someone to sit perfectly straight and those kinds of things. Variety of position is huge. Not being in one position for too long. Little things like setting a timer every 30 minutes just to grab a glass of water. Just little bits of movement. If you have a sit to stand desk, leveraging that. So you're standing for a period, you're sitting for a period. And little things like just altering your low back position. You can tuck your pelvis under, tuck it the other way, just so that there's movement in your day.
You talked about getting up and getting water. You talked about a cup being half full. You've got a glass of water here, and that is, we're talking about hydration. Can you talk a little bit about how important water is to the body and how the body reacts to water?
Hydrate or dihydrate, as they say. It's important. It's super important. We're made up of water. It really is an important piece of our daily habits. In addition to water, so water's first, but we need to make sure there are solutes. There's something that can be absorbed with the water. So little bits of salt, a little bits of sugar, those things help the water stay in our system. So that's an important piece that people can think about. Electrolytes is the buzzword term there. Really important. And I mean, it's talked about at length, but it's still under leveraged, especially from what I've seen in clinic in older populations who are a little bit more static. It's really important.
That is one thing that I find very tough. As we get older, we don't want to really participate in the things that sometimes we should be, i.e. water, i.e. getting up and moving, keeping the synovial fluids moving, and that type of thing. Any little mind tricks that we can play with ourselves, Geoff, to try and keep ourselves motivated and keep us moving and keep all those fluids going rather than kind of getting old and letting ourselves wither away?
Yeah, I don't want that. That's a good question. When it comes to physical activity, my recommendations out of the gate are find something that you like, something that you enjoy. That's often the gateway. If you hate going to the gym, don't go to the gym where you're frustrated, you're irritated. If you enjoy being outdoors, get outdoors. Start with walking, go to a park. If you have pets, a dog, go for that dog walk. Start with things that you enjoy, and you can build momentum from there. Additionally, find a time of day where your body seems to respond to it. For me, it's the morning. That's when my body is ready for it. I find it sets up my day. And if I wait until the end of the day, life gets busy, work gets busy, and it just gets kicked down the road. So those are two things to consider. And the third is embracing some discomfort, especially when you're doing something new. It's okay to embrace a little discomfort. It shouldn't necessarily feel easy out of the gate. A little discomfort's okay. You don't want pain spiking. You don't want things worsening over time, but dealing with some discomfort is important in terms of getting us where we want to go.
Talk about the feel better process of your job, about people coming in, they're in pain. They're uncomfortable. They're chronic. They've seen you several times. Talk about the feel better process from your aspect of being a doctor and watching a client come in and watching that gradual improvement to the point where hopefully they don't need you anymore.
It's huge. It's everything. There can be some long days in this line of work, and that is what fills up my cup. That's what really keeps me going, fills me up. What I really like is seeing people go from discouraged, unhappy, irritated, stressed to hopeful. And that inflection point is so satisfying. And to see that progression from fear and avoidance and neglecting activity to embracing it, to establishing physical activity goals, hearing stories about playing with grandkids or finishing that race or completing that hike, that is what it's all about at the end of the day. That's fun.
Talking about feeling better, people want an environment that they can go into and immediately they feel better. Talk a little bit about Tread Health, where you're located, and the office itself, the environment.
Yes, we're in the beautiful Junction Triangle in the west end of town. It's a great contained little community pocket. We're positioned just east of the tracks along as Dundas West travels south there. It just has a wonderful community feel, which we really try to embrace and give back to the community. We run a run club with the Body Engineers, a gym that's just a few doors down, and are connecting with the local community center. Just at the top of our block. And so it's this supportive, integrated community that we love. We're so happy to be there. And we feel lucky about our space. It's quite a beautiful space, if I don't mind saying. It's rare to have natural light in treatment rooms. I didn't have that for the first 8 years of my career. And so we're fortunate to have a lot of natural light, a lot of plants, and it makes me feel good being in that space. And I think patients feel it as well.
Dr. Geoff Johnston from Tread Health, thank you very much for coming in here. I feel better with you being here already. Where can people find you if they want to come see you? I know you said the area, but tell us your website. Are you on Instagram? Do you have a phone number you can share?
Yeah, our Instagram is Tread Health, easy to find there. Website, treadhealth.ca. Phone number is 647-576-7114. But socials, website, we're pretty easy to reach, pretty easy to find. And we're always just an email away, a DM away if people have any questions about how to find us or our approach. We welcome those questions.
Dr. J, thank you very much for being here.
Thanks for having me.
You're welcome. We will see you next time on the Feel Better podcast. Please tell a friend. We're available anytime, and we'd love to see you here as well.